I love Sinner, our producer, plays this fantastic music, and it just gets me going for the last 30 seconds. The last time I'm going to say this, Happy New Year. Welcome along. We are live, we are uncensored, we're direct, it's radio for adults. This is Men's Radio Station. I'm what's left of Russ Kane. Trust me, for circumstances that I've just explained to Ollie. This is the ABC of CBD with the mighty Mr. Oliver, call me Ollie, Mammon. Happy New Year to you, Ollie.
Hey guys, Happy New Year. Welcome to 2021, the year we're allowed to have fun again, okay?
It was going so well until yesterday in Washington. Oh.
Yeah, what was that? You know what? I don't want to get started on politics.
They need CBD oil.
Dude, like they need a hell of a lot more than CBD oil. Like someone needs a serious reality check. I mean, it's just not cool. It's just not cool.
It's just, anyway, let's not get onto the politics. Let's get on to what we're here to talk about. And I think we've got a kind of almost global exclusive with an hour's show concentrating on the ABC of CBD, which is CBD oil, which I'm in desperate need of right now.
Poor Russ is having one of those.
I'm not even going to go there. I've just caused a total disaster. Anyway, Ollie, you have a very special guest. You've been talking about this person for months, and now we get to meet him. Over to you.
So, first of all, welcome to episode 15. For everyone who showed us support last year over the last 14 episodes, thank you so much. For anyone who's new, welcome to the show. Actually, not a bad idea. Let's play the advert, and then we can run straight into it, okay? It's the easiest way.
I'm sure you've heard before that good quality CBD needs to be really, really expensive. This is the new view of CBD, a product created by users for users, a product at an affordable price, available everywhere, at any time, at the simple click of a button. Just CBD and MCT oil. No additives, no preservatives, and no flavor enhancers. It's a simple subscription-based service, the cleanest possible CBD delivered to your door for the lowest possible price. Your product, your rights for the lowest possible price.
It's a very cool ad there.
Why do I always wear the same clothes that I'm wearing in that video? I mean, like literally, whenever I do this show, it's like a standard. I don't even think about it.
Well, you're like status quo used to be. They only wear jeans and denim jackets. That was kind of it.
It's literally, and every time I watch that video, I was like, Ollie, you need to get a new shirt. That's literally what I think every time I watch it.
We wouldn't know who you were. It would throw us completely.
Guys, will you all do me a favor? Will you buy some Tincture Club products so I can go and buy myself a new shirt? Really, a little favor. Okay. So, everyone, for anyone who's listened to the show, yeah, good. For anyone who's listened to the show over the last 15 weeks, you would have heard me talk about terpenes a lot. And I talk about like this direction of terpenes. Now, our guest today is a guy called Nadav Eyal. Okay, Nadav Eyal is from Israel. He is probably the world's foremost expert on terpenes. He produces them, he studies them, he distributes them. The guy's incredible. I want to give a little bit of an introduction, and I'm going to bring him in, and we're going to basically pick his brain for a whole bunch of information, which hopefully leaves us all a little bit more educated in the end, including myself. So, another point for anyone who's sick at the moment, I really wish you a quick and speedy recovery. Oof. And yeah, the topic of today's show really focuses on terpenes. Now, terpenes, the aim of a terpene is to kind of create a mood in a CBD product. So I'm sure you've all heard me say over the course of the show that not all CBD products are made equal. Different products are made for different purposes. A large influence on what the purpose of this product is in the terpene formulation of this product. So you want to have a CBD product which sends you to sleep. There are specific terpenes you could use as well as other ingredients. If you want a CBD product to liven you up, there are other terpenes you can use. And for every sort of direction or every sort of mood which you would...
I didn't know that. I didn't know you could get... I'd say, could you make me something to liven me up?
Yeah.
Good at the moment. I didn't realize that.
Yeah. So like there are different. So there are loads of counter ingredients you could use as well: echinacea, turmeric, ginseng, and things like that, which would also add they have a symbiotic relationship with cannabinoids in order to kind of create a more uplifting effect. But then you can also use terpenes, and terpenes are very heavily used in this marketplace. Now, a lot of the research, which we all use in regards to terpenes, comes from Nadav Eyal. And a lot of the the ideas which we use when designing products, especially that I use when I design products, they come from Nadav. So when he, he's been my terpene supplier. I think I met him like 5 years ago. I met him at his company 5 years ago, Ebner, and we've worked with them for a very long time. And I'll be honest with you, like I've seen the proof of their product. And one of the good things they do is they do a lot of research into why a product does what a product does, like the purpose behind a product. It's very, very, very important. And it's what separates them from other companies in this marketplace. Now, like we've discussed, so cannabis oils and CBD oils, they're not singular products. It's like cannabis oil is not a singular term. It's a very expansive, broad word, very expansive, broad term. And it's all these different directions are all included in there. So it's very important for people to understand, what's actually in their drops. We talk about the idea of drop tectonics, know your drops, understanding your directions, and terpenes and understanding of terpenes is a way in order to get that or understanding of your product. A little bit like when you go to a bar, all right? And there are hundreds of different alcohols you can choose from. Most people choose an alcohol which suits their mood, and they choose an alcohol which agrees with them for what they want to feel. You have people who drink gin and it makes them depressed. You have other people who drink gin and it makes them quite like lively, and it's quite a clean drunk. Now you have people who drink whiskey and the same sort of effect. And what happens is as individuals, as people, we're all individuals. Our relationship to the products we consume is very personal, and terpenes make cannabinoid products personal. And the more you understand them, the more you will have a better personal relationship with the product you're trying to use. Like the drops I made for you, Russ, 3 months ago, 4 months ago, when you had issues sleeping, they have terpenes in them, added terpenes, which I actually got from Ebner. Do you know what I mean? So because that's why it's got that sleep benefit. But like I said, there are other people who have anxieties and they would need another formulation of terpenes and another formulation of added ingredients alongside the CBD or other cannabinoids in order to give them their desired effect. So it's this, understanding like the directions and the mood of the product. That's really what I want to get into today. And I really want us to start understand the function. It's all about, like I always say again, products with a purpose. There is a reason why this product was created. There's a reason why Ollie Mammon made that product that way. And understanding the function of a product, what it's supposed to do, will very, very often help you identify the product which is right for you. Okay, so I'm not an expert on terpenes. I use them, and I understand how to use them, but I'm not an expert on actually formulating and creating and extracting terpenes. And, it's a very complicated space. This dude, Nadav Eyal, is that guy. And I think, like I said, I've taken up enough of today's episode already. I really want to bring him out because,
I just have to interrupt for one tiny second in case you think, what the hell am I doing? It's that my battery, because of my disaster an hour ago, is about to die. So bear with me, introduce the guest, and our producer will put me back any second now. So you introduce the guest, and I'll be right back.
Nadav Eyal, everybody.
Hey, Olivier, how you doing?
Very good.
Very happy. Very happy to be here with you this evening. Thank you very, very much for inviting me. I hope we will. I'm with you.
It's my absolute pleasure to have you here. Like one point I say, so like over the last 5 years, you've kind of gone out your way to prove the efficacy of terpenes. Now, terpenes have been around for a while, and I'll be honest with you, we all know that they've been used in the marketplace, but there's something which Ebner does, which is different from everyone else, and they provide a story behind their terpene, and they provide a reason behind their terpene. So I remember, I think 4 or 5 years ago, one of the first interactions we had together, I remember we had I spoke to Avi and I spoke to you, and there was, I can't remember how we got into the conversation, but we were talking about migraines. And Avi said to me, he was like, look, take the lemon haze terpene, mix it 10-to-1 in a vape liquid, no CBD, and give it to someone with a migraine. And you will see it will prevent their migraine from happening. So like little things like that, which, like I understand the logic of it, but little bits of information like that, where you guys have actually gone out of your way to discover, applications for your products and discover the best uses for your products and, identify, medicinal attributes of your products. It's not really something other terpene suppliers do. And it's not really something which the market generally does. And I just want to say, look, at the start of this episode, thank you, because you've made me 10 times stronger than, I say a lot of my competitors, because you've given me an understanding of an additional compound I can use in all of my products. So I want to say thank you, first of all. Thank you for all the research you've done.
Thank you.
Let's get straight in. I'm going to fire you like 1,000 questions now. And basically, you've now got the rest of the hour just to kind of answer as you want to answer. But let's start from the beginning. No one gets involved in this industry without a reason. Okay, no one. As in, everyone who's involved in this industry is here for a reason. How did you get involved in the world of cannabis? Because it is that world. How did you get involved in it?
Yeah. So my personal story starts back in 2008. Little bit of a sad story. My mother, that time, was diagnosed with cancer, and at the time, medical cannabis in Israel wasn't available. But people already spoke about the medicinal potential of this plant to help cancer patients. Most of it to go through chemotherapy easier and avoid a little bit of the nausea and then some of the sleep disorders that related to it. And being with my mom in hospitals at that time exposed me to how limited pharmaceutical drugs are, and how limited is the actual treatment, and also exposed me to the sad reality that cancer patients need to go through when they are being told that there is no medicine. And there is a certain point in this horrible disease for a lot of the times. So unfortunately, my mom passed away later 2009, which was a life-changing event for me, and she unfortunately didn't at that time. It was very early, still no medical program in Israel, so she didn't were able to use cannabis. But I was exposed to the problems in the pharmaceutical industry and our actual, let's say, ecosystem as human beings, and also exposed to cannabis and the ability of a plant to might help real problems. And so this is where my journey started. And yeah.
First of all, I'm really sorry that happened to you, man. And it's really sad. It's really sad, and it's kind of what I wanted to get at. Like most of the people we've had on the show, most of the people I've met in the industry who are here and who put their heart and soul, who put 150% of themselves into what they do, they're here for a reason. I had my trauma over my childhood with my Tourette syndrome, and I had to find my cure for myself. That's why I'm here. Years of just torment. Like the fact that you're here sounds sad, but the fact that you're here from pain means that you're here for a purpose. You that pain which you felt, you don't want other people to feel. And I once again, like, I actually didn't know that. Do you know what I mean? I didn't know that. I knew you had a story. I didn't know that. And I just want to say thank you for sharing that with us. I'm sorry for clawing it out of you.
No problem. This was igniting some ideas in my head, and a lot of very crazy ideas that some of them came to life later in my actual career. But a lot about let's say not confirm that this is what's possible in terms of life science. The idea of we can do much more, and the idea of there is a lot of needs to innovation where it comes to life science, and this is what eventually leads later on to the foundation of IBNA, basically. Of course.
So IBNA was founded in 2016?
Yes, so 2014 was the year IBNA founded.
Very early.
So after I was, my professional background is not in agriculture or chemistry or biology, but in data science, and originated from my service in the special units of the Israeli military intelligence. In my position there, I was dealing with the big data project and basically methods to convert data into information and knowledge. Looking on the cannabis space, 2013, when we started to go into this journey, it was clear that there is a big gap of knowledge and data needed in order to expedite the access of the cannabis benefits to more people and patients. And basically, what I decided to do is to take this knowledge and to basically start arrange some of the misleading terms and information that was out there over that time. So at that time, if you speak 2013, and still some of it's still available right now, most of the cannabis space and cannabis industry and products were named by different strains names that are people familiar with, like OG Kush, Mango Kush, Super Lemonade. And this is those terms come from long time of this traditional market going underground and all over the world. But the names themselves are terms that behind them there are composition of compounds. Okay, and those compounds was what was interesting for us, because what we saw back in the beginning is that there are certain cannabis strains that are more beneficial to certain group of people. So for
certain
example, people with specific, so people with specific problems like insomnia, taking one strain more than the other ones, and people that suffer from Parkinson can help their problems with this strain, but that strain is not working for them. So there was clear that behind those strains there are certain compounds that actually make one to be more suitable and more beneficial to certain specific condition. And basically, as a company, we put ourselves a goal to basically connect the dots and understand what are the compounds behind those strains that make it effective, and eventually moving forward down the line to be able to control this type of effects by introducing products that will be more suitable to human beings, basically. And sometimes I like to compare it to the age of first computer, right? So in that time, computer was a big room full of buttons, and only few knew how to use it. But everybody understood that there is a big potential for this tool to expand the human capability of calculating and thinking. But it was required a lot of energy and good entrepreneurs that will be able to convert this technology into simple product and eventually bring this personal computer that now is, for example, is part of everyday life. So I think the way I will look at it is that cannabis is still in these dark ages where people are still looking it, and still the taboo around it, it's a little bit big right now. But in the next following 5 to 10 years, I believe that good people with good minds will help to bring this cannabis plant to become beneficial to more people, and we will be. Yeah,
I like that. I like what you just said.
Mm-hmm.
Oh, there's an echo. Yeah, fine. So I like what you just said about the computer. Okay, and about how the computer was once, a massive thing which no one really understood, and very quickly everyone seems to start to understand it over years and years and years. I feel like that's what we're doing here, because I sometimes feel like I'm in this massive room and I'm like, look at all these buttons, but I'm trying to do it in order to get people to understand that they can also work these buttons. And you look over there and you can get your buttons to go to sleep, and you look over there and you've got your buttons to stay awake, and there are your buttons for anxiety, and there are your buttons for happiness, and there are your buttons for this and your buttons for that. And it's actually, I've never thought of it that way, but it's actually a very smart way of thinking about it. It's very cool. And I want to say, look, well done to you, man, because 7 years ago you went out on a journey, and you've done it. You've really done it.
Nadav, do you have earphones?
Yeah, I have.
Because you need to put them in, if you would. That's why we're getting an echo. If you could put them in, because otherwise we get the feedback from your laptop or PC, whatever you're using. Thank you. That'd be great.
Yeah.
So when was your first interaction with cannabis?
So one moment, I will just put my headphones.
Great. Thank you so much. That's great.
Okay. Can you hear me better now?
Oh,
we heard you fine before. It was me. I had the echo with you, so I'm sorry. It's my bad. Yeah. So when was your first interaction with actual cannabis? So I understand, like army and everything. We've got to like 2012, 2013 now, and then like how did you kind of?
So starting this journey into the cannabis industry, we partnered with one of basically the first medical cannabis supplier in Israel, a company called the Siach Medical Group, which is in some level also sharing part of the story to what makes them got into this industry. Those are my co-founder and partners. We started the research with basically the research we started as an R&D company with this goal of understanding the cannabis plant, and we started from the beginning to develop and cultivate a big database that will eventually allows us right now to build the products that we are now selling and distributing all over the world. One of the first research that was a big and important one was a research started together with the Hebrew University of Jerusalem. This research started with Professor Rafael Meshulam, that is well known as the person that isolated the THC out of the plant back in 1963. And the research we started together with Professor Meshulam was actually about learning. So we came with a very basic question of, all right, we have two strains that two of them have the same THC and CBD level, but one is making you a daytime effect and the second is giving you the nighttime effect. And at that time, in the cannabis space, people spoke only about THC and CBD as active ingredients. So we asked Professor Meshulam, and you cannot ask anyone that knows more at that time than him, what makes the difference, and if it might be coming from other compounds and in the plant. So moving forward, the answer of Professor Meshulam at that time was that this topic is interesting and they don't have a specific answer to give us. And at that time, we decided that we want to start the research on this topic with him. And as a company, we received a license from the Ministry of Health to basically, we were one of the first companies in Israel that hold the license to research cannabis as a company. Amazing. And we started the research collecting chemovars, cannabis flowers from all over Israel, in terms of medical cannabis flowers that are known to be very strong daytime and nighttime. And the idea was taking these products and try to analyze them and try to understand what is inside them that make them so suitable for day and night. And fast forward, what we found out is that there are a strong correlation on the terpene profile of those daytime and nighttime. What leads us to understand that probably, for example, this mood of daytime that is usually called sativa, but eventually its compounds are coming probably from terpenes and certain terpenes combination, and the nighttime come from other terpenes that that found over there. And we call this type of study, as a company, we call it ethnobotanical research, which we are not the first to do. But ethnobotanical research is interesting, and it's being done even, I can say, even thousands of years, looking on certain groups of people using specific medicinal and medical herbs and medical natural products, and try to understand why they are using it and why it makes them feel good and why it helps them, and eventually go all the way back to isolate the actual compounds that make it work and make it uniquely helping them. So this is the type of research started 2015, and I think this is also what opened the gate for us to the rest of the research coming later on in our research and development.
So I just want to throw this in. It's actually not on the plan, but I just want to throw this in. So when I was at uni, okay, this was maybe 2000 and I must have been 18 years old, 14 years ago. So 2006, 2007 to 2009, I was at uni. And when I was at uni, I actually met a grower. Really awesome dude, got on really well with him. He was a lot older, but I mean, he was my supplier when I was at uni. It was incredible. And I remember meeting him, and it was one of the first times ever that I had heard cannabis with names. Okay, because I it was like it was too early. It was 2008. He had cannabis with names, and the names he had were like emotional. So he had one which he called Coca-Cola. And I said, why do you call it Coca-Cola? He goes, because if you smoke this, it feels like you've just drunk a bottle of Coca-Cola and you're going to be running around the room like a lunatic. And I was like, okay. And then he had another one which he called the blues. And I was like, why do you call it the blues? Because he goes, because it makes you feel lower and it makes you feel more relaxed. It's like quite bluey. And he had another one which he called something else. And he had all of these names which are not genetic names. They're not strain names. Now, it's what I actually learned the strains as. So I learned the strain to be blues. I learned the strain. He had another one which he called Molo Mist, because he said it made you feel quite misty. You know, it was a bit more of a, it was like a 50-50. So you had a lot of the indica, a lot of the sativa, but it was like a bit more of a misty sort of, you know, euphoria, as opposed to a high anxiety or a low melancholy, or whatever you want to call, like a lower subduing. And he had these names. And it was like we didn't know about terpenes. He definitely didn't know about terpenes, but it was that whole idea of understanding the direction of the crop he was harvesting. And that's the first time where I started to see differences. You know, like that was my first identification of noticing differences in cannabises. You know, so knowing full well that some cannabis brings you up and some cannabis lowers you down. And it was actually, to be honest with you, it was only when I really met Ebner that I put A and B together. You know, the first time I remember I spoke to Avi, it wasn't like, oh, this is incredible. It was, oh, this makes sense. You know, and it's kind of nice when you have that sort of interaction with something, a little bit like the gin and the whiskey and the rum. And like I was talking before, where every alcohol has a different interaction with the individual. It's nice to have that understanding of the compounds you have, but it's incredible the fact that you've broken it down even more. And I just wanted to, before we move on, I just want to say, like, it's part of that hidden knowledge. I've mentioned this on a few other shows, this idea of hidden knowledge, you know, this understanding of cannabinoids on a you know, it's not a basic level, because it's more than that, but it's not science, because it hasn't been put through the machines yet to be called science. But it is that sort of understanding that there is more to this plant than just getting you high, or CBD as a, you know, revitalizer, rejuvenator. Everything has its direction when used properly, and the minor cannabinoids, as we've spoken about way before, which I know we're not talking about today, but like the minor cannabinoids or the change in minor terpenes or flavonoids can have a massive impact, as we discussed with Tanine. Do you remember Tanine said that she had you know, she had a batch which changed, and then she spoke to, or was it Callie Seaman, Dr. Callie Seaman? One of them said that they had a batch which changed, and every 3 months they noticed that there was like a change in the reaction from their consumption. It's just it's pretty incredible. But it is important for people to learn this stuff. You know, it's really important to kind of get in there. So my next few questions are a bit more to get into the understanding. What is a terpene?
Good question. So terpene basically are a class of aromatic organic compounds found in diverse plants in nature. So we find them in a lot of different sources. Cannabis is one of them. They have multiple purposes for the survival of the plant. On one hand, they attract pollinators. So because of their aromatic profile, they are responsible to bring the pollinators to the plant. But on the other hand, they have strong antimicrobial and antifungous properties to help protect the plant, the health of the plant from different different disease. And this is what shows you, also can give us a little bit of a clue how unique their mechanism is, mechanism of action, in high level it can be do one thing, and small level it can, for small things, it can do different things. In general, terpenes are above 0.05% considered to have pharmacological benefits for humans. So that's something important to remember. So very small dosage already been proven in some clinical trials to have real benefits for human beings.
Isn't it incredible? Isn't it incredible? Yeah. Let's just pause for 1 second and go back. Isn't it incredible that something that protects a plant in nature can also kind of protect us and make us stronger in nature? As in, it's I know it's like common sense and common knowledge that natural things are good for you, but I mean, it's pretty incredible that something which is produced by a plant in order to kind of make the plant stronger also has the ability to transfer over to us and make us stronger. It's pretty symbiotic, you know. It's quite cool, you know.
Don't forget that we are 99% similar to any plant in the world. So there is we are sharing a lot of the same problems.
Carbon-based life form, right?
Even when it comes to attract pollinators, you know. So it's like that's what I'm saying. It's we are sharing the same problems, and we are all building through a lot of very similar mechanism in order to survive.
One more thing. This is going a bit more humorous now. Okay, fine. So plants create terpenes. Okay, plants create terpenes to attract like bees and stuff to pollinate. All right. We spray cologne on ourselves, which is made out of terpenes, in order to attract women, in order to pollinate. It's a little bit mental, as in like it's a little bit crazy. Do you know what I mean? It's just a little bit. Sorry, just thought I'd throw that out there. Once again, I did say it's a little bit off topic, but carry on. It's a little bit.
We are part of nature, and this is why it works like that. And again, we are usually like to say that those compounds are highly active compounds that happen to interact with our olfactory system. Sometimes people think that because something have a smell, it's only a smell. But basically, those compounds have much more than this interaction with our olfactory, and they have much more mechanism of action when it comes to the human body. And again, this is why we also, as a group, as a company, decided to invest our research into understanding those compounds.
No, fair play. I got a question. I heard through someone else that apparently, and you can stop me if I'm wrong, because once again, I'm not an expert on terpenes. It's just knowledge which I pick up along the way. Someone once told me that terpenes are compound nutrients. So the nutrients found in a terpene are actually, it's like similar to a microgreen. It has very large proportions of nutrients in comparison with, you know, like, for example, the terpene of a lemon will have a large proportion of nutrients in the rest of the lemon. Is that true or is that not true?
Terpenes have certain different medicinal, we can say nutritional benefits that, by the way, I believe that each one that is now listening to this radio show probably consumed some terpenes since they wake up in the morning, because they are really how if you eat any type of fruit like orange, lemon, strawberry, you probably ate some. If you even drink a nectarine, citrus
coffee
is full of terpenes. Even coffee in some level, not the highest level, but you can find some.
I want you to do something, but there's something in coffee. I don't know what it is, but you know they say the nose knows. Okay, yeah. There's something which I get every single day. I get something from my coffee. I don't know what it is, and I create
burnt fingers.
No, it's not that. I'm talking about it's a smell. There's a smell which comes off my coffee every day, and I'm like, don't get me wrong, I know it's coffee, but there's something. There's definitely something in coffee. I don't know what it is, and I personally feel like the caffeine is probably counterintuitive against it. But I mean, there's definitely something there. You'll see. 2 years' time, they're definitely going to be like, guys, guess what? Cure for cancer, coffee. No, it's going to come. It's going to come.
Well, guys, I've got to apologize to everybody because I've got this technical glitch, and because of a horrendous accident about an hour ago, my battery is about to die on my laptop. So Nadav, it's been an absolute pleasure, but in case my image just disappears, in fact, I think I'm going to have to. I'm so sorry, Ollie. I really am, because I've got 12 minutes left on my battery. I can only apologize. I can
go do your thing. I've got this. I've got this.
No apologize. Nadav, it's been an absolute honor. And
all right. I think he's gone. Yeah. I love you, Russ. Bye, buddy. In case of, for those of you who don't know, Russ decided to try and start an electrical fire before the show, and he basically he basically blew up his house. It's not like blown up. I mean, he's got no electricity and nothing. So I mean, the poor dude, he is not having a good day. So yes, you're just saying, so terpenes are not, it's not a brand new invention. It's something which already exists in nature, something which we consume on a daily basis. We talked about where terpenes can be found. They're very often in fruit and natural organisms which have pungent smells, you could say. Any natural organism with a pungent smell would have a terpene?
Most of them will have terpenes. Yeah, so most of them. But some smells that we smell are not only terpenes. So smells are coming from also some other groups. Yeah.
But what about outside of the natural products? Would people consume terpenes and use terpenes in other products which are not fresh fruit? Do you understand what I mean? Is in like,
of course, there. I think there is no perfume in the world or no cosmetic product in the world that not containing terpenes. All right, so a lot of the food we eat, if also the ones that are not fresh fruits, contain terpenes to make them taste good. So the food and beverage industry, using them to make products attractive, basically, cosmetic the same, and also pharmaceutical industry in some level. So in certain products.
Mm-hmm. So the terpenes you use and the terpenes, so the terpenes you create, all right, they're different from those sorts of terpenes, aren't they?
Yeah. So there is a lot of usage of what called synthetic terpenes in these specific industries, which we do differently. We as a company believe that there is something around this natural derivation that we still don't understand as humans, that is important, even though there is, in terms of chemistry, it's the same compound. If you try to look at it from the chemistry perspective, but as a company, we are producing and selling only natural-based terpenes. And one thing that we are doing differently is the way we are manufacturing and eventually distillating each terpene. CBD, for example, that there is different qualities for CBD in different, let's say, purity level. So terpenes, we are speaking about a group of over 100 compounds in the cannabis plant. We speak more closely to 200 and plus. And if you try to look on a formulation and we try to look on a product, it's very important that the purity level will be high in order to, first of all, make sure that you use the compounds that you want and not the rest of the things that can be there. So the purity level is very important. Also, the method of extraction, how clean is the solvent you use, and things like that. We are not using any solvent other than steam distillation, which is water, and some different separation technique. So those things are very important in terms of the quality. And this is what makes the difference. Basically, if you try really to look deep into a product that is a terpene product, you will see that this is where the fine tuning comes in play and the quality comes in play. Yeah.
Listen, I'm not going to lie. The quality of your terpenes is pretty awesome. So I mean, I've just got to throw it out there. You know, I've tried a lot. I mean, I've tried a lot of what's available on the marketplace, and there is a big difference. And one of the things I find comfort with is everything I do is always natural. You know, like I'm not anti-synthetics, but I'm not pro-synthetic. So the whole idea is if someone can find a synthetic anything, and it is exactly the same as the natural, as in it's not an isomer of, it's not similar to, it is exactly the same, I've got no problem with it. But the ability to create something in a laboratory which is exactly the same as something which is created by a plant is physically impossible. It just it's always missing, you know, like you look at the cell structure, it's always missing one of the lines, or it has 3 more lines added onto it. It's always slightly different. And I understand your position as only using natural terpenes. You know, I get that. And to be honest with you, I think that's part of the reason why I, you know, love your products. What I wanted to ask is what is the difference between terpenes and flavonoids? And I've got another question afterwards, which is what is the difference between terpenes and essential oils?
Got it.
It's like I think I get it. All right, and let me explain why I think it is, and you can tell me if I'm wrong. So an essential oil is almost like the full spectrum. So it's a full spectrum extract of the plant, and inside that full spectrum, you have got broken down a plethora of terpenes and flavonoids and other aromatic sensory compounds which are also in there. And then you break it down to find the terpene which actually has the effect. So we use this conversation sometimes to try and educate clients the fact that you have lavender, and lavender is proven to help people sleep. However, if you look deeper into lavender, you will find lilanol, and lilanol is the active compound which helps you sleep in lavender. We also use the same example when it comes to turmeric. You have turmeric, which is the broad spectrum product, and then you have curcuminoids, which are the active ingredient inside turmeric, which give you the benefit. But however, curcuminoids can then be broken down even further, so it's not the best example.
Yeah.
Am I right or wrong?
Yeah, first of all, you're right 100%. The essential, I will start with the essential oil. The essential oil are basically this is what the plant produce, and this is the mixture, a mixture usually of different terpenes. So if you try to look on lavender, as you said, highly in linalool, which is one compound out of the mixture. Lavender can have 40% linalool inside the essential oil, and 60% of other things. And the other things are usually other terpenes. So the difference is this is the mixture and this is the single compounds. For example, cannabis essential oil, by the way, known today to be the richest in variety of different terpenes. As I said, 200 plus different terpenes already recognized in the cannabis plant, much more than any other plant in nature. What makes this challenge of understanding this plant a little bit more complex. But what is, and also it's important because if you try to look at it, essential oil usually work in some sort of a synergetic way. Okay, so if you try to look on linalool is one compound, but there are other compounds that usually, if you look on the mechanism of them, they are working together to achieve something. And this is why, at the end, if you try to look on terpenes, it's very important to understand the different compounds and not looking only on single terpenes, because usually what you will find out that some compounds are working together to achieve one benefit. So, for example, if you try to look on the anti-inflammatory qualities of cannabis, they are not coming from one terpene. They will not come from 5. They will come from 30, 50 different ones. that will be working together to achieve something that is greater than one. So
it's the same as let's say when I make an anti-inflammatory product. Do you know what I mean? I make something for pain recovery. I'm not just using menthol crystals. I'm using camphor and moringa and copaiba, and I'm using lavender and rosemary and thyme and everything. I use maybe 15 different essential oils, which probably have inside of them however many different compounds. You know what I mean? Like, it's all about, you know, creating as much of that entourage effect as possible, right?
Yeah. Exactly. And this is what makes it interesting, because as they are working together, we still don't understand exactly how, you know, but there is one thing that is for sure, that compared to the pharmaceutical industry, where it's always one API, one compound, the natural products like terpenes, like essential oil, are working in a much more complex way. And basically, also because of the complexity, and I will not get much deeper into it, but also it gives some sort of quality in terms of toxicity. Why? It's because you have so many compounds working together in small dosage, and each one bring its own, that the body know how to tolerate it, you know? So compared to one compound in very high dosage, which is sometimes synthetic, never being introduced to our human body in the last thousands and thousands of years, you can see that products that are coming, like, for example, essential oil or other cannabinoids that found in nature, are also less toxic and more effective. So this is, if you try to look long term, this is what also make it so interesting as a topic to research when it comes to life science. Now, for your question about flavonoids are compounds that found also in the cannabis plant, but again, not unique only to this to the plant, not only to the cannabis plant. The main difference between terpenes and flavonoid coming from their molecular structure, which is different. This is why they have a different name. Other than that, flavonoids are much less volatile as a group. So terpenes, you put them on a table, you usually will smell them because they're volatile, they evaporate, they get into your nose. Flavonoids are much less volatile. They are usually in a form of a solid form, a powder-like, compared to terpenes that are usually in a liquid form and get very easily into gas. Yeah,
something new every day.
Yeah. So and flavonoids are what?
Can you get me flavonoids?
Yeah, let's speak about it later.
I just want to play. I want to play around. That's super cool.
So they are very interesting. Most of the flavonoid already been proven to have very strong antioxidant properties.
Amazing.
That have a lot of positive benefits to us. And the main places, if someone like for humans to consume them on a day-to-day diet, is green tea, for example, and red wine. Both, if you know that there is some conversation about their medical qualities, the benefits coming from the flavonoids
That's good to know.
found in them. Yeah.
Do you think that the application of flavonoids is going to become more active in this industry?
For sure. By the way,
which is not really being used at all with flavonoids. It's not being used, you know, like, I mean, as an infusionologist, I've never incorporated flavonoids into my product. I do when they're naturally there already in the extracts which I'm playing with, but I mean, I've never brought it as an added ingredient and thrown it into the mix. And I think it, you know, moving forward with please God, some good research from you guys, you know, we can play a bit, make a bit more, have a bit more fun. So I wanted to ask you, we've got 12 minutes left. So I wanted to ask you, I've got two topics here, both of which I wanted to discuss. So we can either discuss the medicinal value of natural compounds, or we can discuss the demonization of cannabis. Because I feel like 12 minutes is, we might be able to do both, but I don't know, what would you prefer?
Whatever you think is the right for this show. Let's start.
How can you quantify what counts as the medicinal value? So you talk about the medicinal value of terpenoids. How can you quantify what counts as medicinal value? They talk about, you know, when you run a test, you need to have 65% result in order for it to be classified as a medicine or something like that. So how do you, you know, like how does your research prove tangible?
So in order to to really quantify the quality, the medicinal quality. The pharmaceutical industry and the scientific community build very reliable tools to measure quality of active ingredients. It's from preclinical studies in cells in the lab to clinical studies in hospitals. There are very specific methodologies in order to show and demonstrate the quality or the medicinal quality of compounds. Okay, so the way we are working in order to demonstrate the qualities of cannabis is the same ways, taking the from what's called in vitro, which is studies done in cells, to all the way to clinical. We believe that this will be the only way to be able to show that cannabis have the same, if not greater, qualities than pharmaceutical and then any other medical products out there. Because again, if we try to look on the main market that's looking now on cannabis and CBD and ask themselves, is it going to be good for me? It's going to make me high? What is it going to make me? A lot of them are the older people, okay? And older people learn that something that the doctor gives to you is the right thing. And in order to get to this point of all the people using cannabis for their own benefits, we must do scientific research that is using the same methods and using and showing and demonstrating that those products are actually working and not just another alternative something that is not true.
Exactly.
Yeah, exactly.
So like it's one of those things that's been brought up again and again. Israel's actually incredible because Israel does research and it's been doing research for 30, 40 years. You know, like Raphael Michelin started in late 80s or something, early 90s. You know what I mean? So Israel's been doing research for a very long time. A lot of our guests who come on who are either UK based or we had a South American doctor, her name's Dr. Sandra Carrillo, and she was talking about the lack of research and the lack of evidence at hand to be able to show other patients. And it's basically, I think the two conversations just joined it. It kind of falls into this demonization, doesn't it? It's like the doctors in the UK I'm not saying they don't want to, but the system is not letting them learn about cannabinoids, it's not letting them learn about this. And research like this is definitely not happening here. And it's leaving us very short because what it means is it's kind of like it's turning your back on what could also be something potentially good for the population. And I find it very hard because more often than not, you know, even though now you can go and get private prescriptions for medical cannabis in the UK, a lot of doctors are still pushing their patients away from those decisions. And I just feel like maybe a bit more research. Do you know what I mean? If you can, if you can quantify the medicinal value of terpenes and quantify the medicinal value of cannabinoids, it will only encourage these doctors who need to see the research, because that's how they change their opinions, is when they see the research. You know, exactly. It's so important. It's so important what you're doing. But I find that. Sorry.
Yeah, I will give you an example. One of the last studies that we recently published was on a new product called the anti-VRL. And basically, as I told you, we cultivate a very interesting database of the isolate compounds in the plant from the beginning of the company. And one of the main qualities that were very that we saw from the beginning was that terpenes have very strong anti-inflammatory properties. Not only that, they've also been proven in some different studies to show antiviral properties against viruses like herpes and HIV. Okay. So when the COVID-19 started, we asked ourselves, can we use this knowledge in order to design a formulation that will have both anti-inflammatory and antiviral properties that might be able to help COVID-19 patients? And because at that time, nothing, you know, the world is a crisis, there is a big crisis. And we went to this journey, starting to very, very intensively researching this topic. If you try to look on COVID-19 today, the main reason for the death-related COVID-19 are associated with what called cytokine storm. Cytokine storm is an immune response, which is basically if you use right now, if you try to let's say treat the main treatment for that is a steroid called dexamethasone, which is anti-inflammatory drug, right? So what we did together with the professor Dedi Meiri from the Technion, we decided let's put ourselves to a challenge here. Let's see if our formulation of terpenes together with CBD can be better and more beneficial, more effective than dexamethasone. Not really the thing that the drug that people are now using in hospitals. And the result were amazing, so amazing. We didn't expect that, and by the way, they were published in some different articles. One of them is in Forbes. So and we basically were able to demonstrate that terpenes have stronger anti-inflammatory qualities than dexamethasone, 2 times fold.
Amazing.
And without all the side effects that associate with it. Down the line, we continue this research to basically study the same terpenes with human coronavirus that we are in few weeks, we're going to publish the result that were also amazing. Incredible. And right now we are working to take this product all the way to some clinical trials here in Israel with one of the largest hospitals. Hopefully we cross all the way from this witchcraft to a real medicine coming from these natural products. So I just wanted to give you this type of, you asked the question how you quantify. So I wanted to show you exactly what do I mean when I'm saying.
So I mean, first of all, that's incredible. But I mean, natural relief from these viral infections has been common for thousands of years. I mean, if you go back to like the 1900s when I think it was the Spanish flu took over everything. You know, like a standard remedy for that would have been like a juniper berry sort of concoction, like a juniper berry tonic. Okay, you know, like there's loads of like you could say these herbalists out there who would have put together combinations of different herbs in the past in order to create cures for these viral diseases. I think it's incredible. I think it's absolutely incredible. And the amount of, if you go back 70 years, the pharmaceutical industry didn't exist. It's like 70 years, it's 80 years. You go to like 1940s, pharmaceutical, it wasn't really a thing, and before that, in the 1920s and 30s, people were using not terpenes like you're creating, but natural products made from plants and made from, natural compounds. And I feel like we've gone kind of full circle again. You were like, it's almost like we're going back to the beginning. Like we're going back to like the like grandma who had a little garden in the back where she had all of her herbs and she would make you whatever you needed. You know what I mean? It's like gone back to the days of witchcraft. It's incredible. But what I don't understand is, so you now have this cure for COVID, this remedy for the ailments of COVID. Do you think that people who are anti-cannabis would be anti this? As in, do you still think it would be hard to encourage people to use it? I think it will be impossible. I think it's going to be impossible.
First of all, this formulation is not containing any of the psychoactive part of the plant. And so no THC. And so if you try to look at it, it's very neutral products that and compounds that have actually very nice smell and taste also, and can be distributed probably everywhere. So I think that there is a big possibility for people that try to, let's say, boost their immune system, and a little bit similar to what's going on right now with the vitamin D. So people understand that they can do something to help them increase the odds of stay healthy. And I think this is exactly where this type of products can be very beneficial. So Yeah.
Look, I can't wait to see what else you guys come up with. You know, like we work super close. I mean, guys, if you ever want any of Nadav's products, come to Taylor Mammon because we use all their stuff. But I can't wait to see what else you guys do. I know this is not the last time you're going to come back onto the show. Like, I'll be honest with you, in 3 weeks' time, when you get your results, if you want to come on the show and talk about your results of your data about, terpenes and COVID, we'd love to have you back. You've been an incredible guest, man. You're in this business for the right reasons. And seriously, thank you so much for coming on the show. And to all of our listeners, thank you for tuning in. And we'll see you again in a couple of weeks, or see you again next week. And Nadav, please God, you come again soon, okay?
Thank you very much. Have a nice evening. Bye-bye.
Bye.